Hi, my name is Erica Turner, and I'm a licensed marriage and family therapist and owner of Rosewater, a therapy practice in Alexandria, Virginia, just outside DC. And I wanted to talk a little bit today about a technique that I use with clients as a way of thinking about managing difficult emotions, particularly anxiety, but really it could be for any sort of difficult emotion that it's hard to sit with. And essentially the idea of thinking about a difficult emotion and managing that in a similar way as we manage physical discomfort. So one of the big examples I use is if you work out, let's say that you like to run, and as you're running, you may notice all sorts of things happening with your body, right? Like you might notice that your feet hurt, you might notice that you're sweating, you might notice your heart's pounding, and as you're doing that exercise, you continue to move forward even though you feel that physical discomfort, right? Like even though I feel like my breath is getting shorter and I gotta really think about how to pace myself. Also, I hate running. I use this example, but I actually hate running. But it works for any sort of physical exercise that you might do, that you continue to move forward and you continue to do the work because you want the result, right? Like you want to be able to run faster. You want to make sure that you get, a good burn in, that you get good exercise, that your heart gets a good workout. And so you push past that physical discomfort in order to achieve those results. And that essentially you can think of managing difficult emotions in the same way that you don't turn away from the emotion, right? Like I don't want to ignore my heart pounding or my breath getting short when I'm running. I need to monitor it. I need to be present with it, and I need to, keep an eye on it. But at the same time, just because I have that feeling, it doesn't mean I stop, right? Like I don't just stop running the second that I feel uncomfortable. I sort of take stock. Okay, am I running at a pace that's, maintainable? Am I, keeping my breath in the way that works for me in the long term, or however long I want this run to be? And that we can think of difficult emotions in the same way that I experience it and I am present for it, but I don't let it dictate my decisions in and of itself. That essentially I decide whether or not I'm going to stop running, and I decide that if I have a strong emotion of sadness, what am I going to do about it? If I have a strong emotion of anger, what am I going to do about it? How am I going to handle it? That if I have that strong emotion, I don't just say, well, I feel this way, so that's it. I'm just going to do whatever that emotion tells me to do. Or often what I see too is, I have this strong emotion, I can't bear it. I can't endure it. And thinking about it as a process that you sit with, that you are present with, but that you control how you respond to it. And it can be tough. I would say that it is a lot of the work that I do with clients is teaching ways of being comfortable with difficult emotions, that our emotions are important. They're trying to tell us something about what we need, who we are, what the situation is. They are a messaging system in a lot of ways. But just because you have an emotion, it doesn't mean that you just need to do whatever that emotion is indicating. So there's a delicate balance between being aware of and present with emotion, accepting it for what it is, not judging it, not judging yourself for having it, but also sort of saying, I'm the one, like my whole integrated self, both the sort of like rational, logical part of my brain and the emotional part of my brain, which is not really accurate idea of our brain, but that's kind of our common conception of how our brains work. I get to decide from a place that comes from all of that experience, from both my emotional knowledge and then more of what we would think of sort of as our rational, logical knowledge. And that if we think, to ourselves, I am going through this emotional process and I am aware of it and present of it, and I can endure it. I don't have to do what it's telling me to do. I can choose how I respond to it. So that's just one of the ways that I work with clients to sort of help frame difficult emotions in a way that feels manageable, and in a way that honors what's happening to you, what's happening inside you, and honors the truth of that, like what those emotions are trying to tell you about who you are and what you need, but then also gives you the chance to figure out how you want to respond to it and what you want to do about it. I'd love to hear folks' thoughts about this technique. If you do anything similar or have questions about it, love to hear more. You can comment below, or find me on Facebook or Instagram at Rosewater Therapy. But I definitely love to hear from folks about this technique. Thanks.